Good morning. My name is Tay Daybear, and I am honored to have you join me while I present this reflective video on my journey through the BSN curriculum and capstone project with Capella University. This reflection video will cover the application of evidence-based practices in my capstone project, the impact of technology on therapeutic approaches, and the correspondence between initial predictions and actual results. I will discuss the significant impact of my journey while obtaining an RN BSN degree and capstone project on my professional career and personal growth. A chronic health condition. Diabetes, particularly type 2 diabetes, was selected for this project because of its profound and enduring effects on people, family, and communities worldwide. Even though diabetes is a chronic condition that can be managed due to medical improvements, people still encounter many obstacles. Individuals with diabetes face numerous challenges, including managing the condition, overcoming systemic, psychological, and financial barriers, accessing care, mental health assistance, and the cost of continuous treatment. The body's inability to properly use and create insulin is the hallmark of type 2 diabetes, a disorder that raises blood glucose levels and causes long-term health problems. Metformin, insulin injections, regular blood sugar monitoring, and dietary changes limiting carbohydrate consumption are necessary components of individualized approaches to managing type 2 diabetes. By creating lifestyle changes, including eating a balanced diet, cutting back on calories, and exercising, individuals with type 2 diabetes can manage their glucose levels. National Institute of Diabetes and Digestive and Kidney Diseases 2024. The patient. For my capstone project, I selected a lifelong friend of mine, Diane Tebow. Diane is a 50-year-old African American who was diagnosed with type 2 diabetes 7 years ago. Her blood sugar ranged from 200 to 370 milligrams per deciliter, and her A1C was 8%. Due to her family history and genetics, she also faces hypertension, obesity, and cardiovascular disease. Her obesity is attributed to her insufficient physical activity and poor dietary habits. Initially, she controlled her condition by insulin administration and dietary modifications. Diane lost over 55 pounds through healthier eating habits, spin classes, and tirzepatide injections, practically eliminating her daily diabetes medication requirement. Diane manages her diabetes effectively by adjusting her diet and engaging in physical activity, including walking 1 mile 3 times a week and attending spin classes. She intends to participate in more community events to raise awareness of diabetes and investigate sugar-free sweets and dessert options. Diane is eager to participate in a local community that will enhance her knowledge and self-management skills for the future. We discussed recognizing hypoglycemia and hyperglycemia symptoms. And Diane knows to consume orange juice or candy when her blood sugar drops, but was unclear as to what the process entailed. I seized the opportunity to educate Diane on the 15-15 rule and how it applies to a person whose glucose level has dropped below 70 milligrams per deciliter, which is dangerously low. The patient needs to consume a fast-acting oral sugar equivalent to 15 grams, recheck the blood glucose in 15 minutes, re-administer as needed, may repeat 3 times until blood glucose is greater than 70 milligrams per deciliter. Centers for Disease Control 2024. Proposed intervention and patient satisfaction. During our 3-hour meeting, I gained insight into Diane's journey with diabetes and discovered effective strategies to help her manage her condition effectively. For Diane, I designed a customized brochure that highlighted resources and risk factors and offered a range of therapy choices. Diane found the brochure to be very helpful as it gave her clear and simple information about how to manage her diabetes. The experience also instilled in her the confidence to actively participate in her treatment. Diane's feedback highlighted several key aspects of the intervention that positively impacted her. Diane acknowledged her respect for the brochure's content, praising its clarity and the fact that it applied to the situation. Additionally, the sections on diabetic therapy and emergencies supplied her with helpful information, which clarified her treatment plan and made it easier for her to take her medications as needed on a prescribed schedule. Diane was grateful for the insightful instruction on how to live a full life despite having diabetes, which improved both her overall well-being and her level of comfort daily. Diane appreciated the brochure's list of online resources for accessing community services, education, and support groups as a valuable feature. This knowledge gave her a sense of belonging and connection, which in turn allowed her to connect with other people who were going through struggles that were comparable to her own. The experience provided her with both practical assistance and emotional support, which helped her become more resilient and improved her ability to cope with difficult situations. Diane also appreciated the informational brochure's positive impact on her health, encouraging a proactive approach and enhancing her understanding of diabetes care. The fact that the intervention was tailored greatly boosted her level of satisfaction with the treatment she received. As a result of the intervention, Diane's quality of life dramatically improved, which demonstrates the significant influence that individualized, patient-centered instructional materials can have in the treatment of chronic illnesses. Evidence and peer-reviewed literature resources. For my capstone project, I gathered credible information using reliable, evidence-based methods and resources, which allowed me to develop a customized solution for Diane. We prioritized sources from domains like .org, .gov, and .edu to establish legitimacy. The study utilized peer-reviewed materials from databases like PubMed and the National Institute of Health published within the last 5 years to include recent discoveries. I also utilized Capella University's Summon online library search engine to filter research to include articles from the last 5 years, avoiding outdated and unreliable sources for managing health conditions like diabetes. Nurses utilize evidence-based practice to enhance the delivery of efficient medical care. The newest research findings, clinical knowledge, and the individual patient's values and situation are all components of evidence-based practice. Abu Baker et al. 2021. Technology. The management of chronic illnesses like diabetes has greatly improved because of the integration of technology in healthcare, including digital tools, artificial intelligence, telehealth, and electronic medical records. Diabetes technology is constantly evolving, contributing to our understanding of human biology and enhancing the quality of care for individuals with diabetes. Edelman et al. 2023. Technological developments in healthcare simplify remote consultations, increase professional collaboration, expedite patient care procedures, and improve access to medical data. Healthcare providers use technology to deliver more effective, individualized, and accessible care, improving health outcomes for people with chronic diseases like diabetes. Online platforms were used in Diane's educational brochure to improve the accessibility of important health information. This project demonstrates how digital platforms may improve healthcare technology by providing individualized patient feedback for better treatment. Mobile health apps can improve patient participation by facilitating medication adherence and lifestyle adjustments. By tracking patient outcomes, spotting trends, and raising the standard of treatment, data analytics helps increase patient involvement and the general quality of care. Government policies. Healthcare policies served as the foundation for the suggested solutions for Diane, ensuring affordability and removing obstacles. The Affordable Care Act of 2010 has had a substantial impact on the delivery of health care in the United States, particularly for people who are managing chronic diseases such as diabetes. The Affordable Care Act specifies that individuals with pre-existing conditions are eligible to have health insurance. The HCA encourages healthcare groups, citizens, and the government to work together so that everyone can get health insurance. ISOLA 2023. This ensures that millions of diabetic Americans have access to necessary services. The Affordable Care Act has emphasized preventative health care with the goals of increasing awareness of illnesses such as prediabetes and expanding opportunities for early detection and therapy. People with diabetes now have better access to health care because the ACA expanded reimbursement programs like Medicare and Medicaid. Predictions and outcomes. The Capstone Project demonstrated the effectiveness of an educational brochure intervention in enhancing patients' understanding and treatment of diabetes. The intervention raised care engagement and enhanced diabetic medication adherence, underscoring the value of patient-centered educational materials in the management of chronic illnesses. Using research and literature, I anticipated Diane's positive response to my interventions, which proved accurate after several hours of collaboration. Diane engaged in our conversations and asked many questions, and I constantly provided her with the most recent findings to clarify her inquiry. Personal and professional growth. My capstone project and the RN to BSN curriculum have greatly advanced my professional and personal development. Diane's experience made it clear how crucial it is to take ethical issues into account when making decisions, particularly when dealing with complicated patient circumstances. This journey has instilled in me the importance of applying evidence-based practice within my line of work. Despite challenges, I am now more capable of maintaining patient autonomy, professional standards, and patient advocacy. The BSN program's demanding curriculum and practical experiences, which ingrained a strong sense of duty and moral responsibility, are responsible for my personal and professional growth. The RN to BSN program has given me the tools I need to elevate patient care by following professional and ethical principles. In addition to giving me the skills I need for contemporary nursing practice, the program encourages a lifetime dedication to learning, development, and patient advocacy. Thank you.